Before having a breast reduction, consider your whole body shape. So most commonly with women who are looking for a breast reduction, particularly women with substantially larger chests, they want that weight off their shoulders. They want everything gone and to be as small as possible. But one of the things to consider is your overall body shape to make sure that you remain in proportion. If you are maybe a size 14 to 16, to have a B-cup chest wouldn't be in proportion. So that's something you might want to consider.
So before getting a gastric sleeve, you need to remember it's a psychological process as well as a physical process. You need to be in the right mind state. If you're not in the right state of mind, you're not going to success in your gastric sleeve surgery.
When considering excess skin removal following a weight loss journey, it's super important to make sure that you're totally ready. And I know for a lot of patients, when they're in the midst of a weight loss journey, they just can't wait to jump to that next step. But maintaining a stable weight is so important. It's important for recovery, it's important for skin quality, and it's so important for the overall result. So it's really, really important to understand that you need a minimum of 6 months at your stable weight, ideally a year, and that just allows you to go to the next step of your weight loss journey positively.
Effective. What I tend to find is when they're first coming in for the consultation and they've been with the surgeon or I'm in chatting away with them, they tend to think that having that size of breast, that implant, is going to fix everything, but it doesn't. It's got to match their actual physique. So therefore sometimes getting the sizes that they think they want is then going to give them a complex about other parts of their body, so they need to match it so that everything works, because they don't realise at the time that maybe having these breasts is going to then enhance. Maybe they've not got the biggest waist that they wanted, or their belly's a wee bit bigger. So sometimes I think they need to think about that. And everybody else is a completely different shape and size, even if they're getting lower or higher.
So my advice, if you are thinking of a breast augmentation, is maybe take into consideration pre-kids, post-kids. I am a mum myself, so you've really got to think about what I had before having my child to what I've got now is very different. So when you're coming in to discuss sizing and your outcome, is maybe to kind of keep in mind that there's changes that have happened throughout pregnancy, and that will contribute to the surgical plan.